You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic, Dr. Paul Berger. Dr. Berger, welcome to the program.
Thank you for having me, Randy.
Now, and I know you brought a lot of photos, so we'll get to as many of those as we can. But for people that don't know your practice, and specifically on the mini implant side, who's the typical patient coming in for tooth replacement with mini implants?
The typical patient is one that is wearing dentures. It's loose and uncomfortable, and or people that are on their way to dentures. They're missing teeth. They're painful when they eat and smile, and they're embarrassed with what they're having to put up with, and so we're trying to help them out with the small diameter implants.
So a lot of people, I guess, in your area, in Sonora, is that right?
Yes.
That they've heard about you. You do a lot of direct mail, things like that, bringing awareness to the implant. But is this the newest trend, the hottest trend in dentistry, is replacing teeth with these with the implants?
Yes, it is, and we're fortunate from that standpoint because patients typically have not been able to retain their dentures. They have nothing that attaches these dentures to their gums or their mouth. Their teeth typically are not stable. They're having to use a lot of adhesive, and these small diameter implants are an answer to taking care of that problem. Okay,
good. Now, are there a lot of people where you are that have dentures, that are wearing dentures?
Yes, our area services anywhere from 65 to 100,000 people. There are tens of thousands of people in our area that wear dentures or partials that are ill-fitting. I would say that close to half, because we have a huge retirement community.
Now, if locking in teeth on these mini implants, if it's so good, why isn't everybody doing it? Why aren't they coming in? What's your take on that?
They've been used to not going to the dentist because now they're rid of their teeth. So they stay away from the dentist as much as possible. Their history has been one of failure to get them to the denture stage.
So they don't know their options, is what you're saying?
They don't know their options, and now with the advertising that we've been able to place, they've been able to see that there is an option, and we're able to give them some help in that.
So no more dentures?
No more dentures is what my byline is. Throw those dentures away.
Throw those dentures away. Now, we should mention how it's normally done is when you get dental implants, you go to one doctor that does a surgery, then you go to another doctor that puts the teeth on top, and maybe somewhere else for the imaging. You have this all under one roof approach, like you do everything right there.
Yes, we do, and that's an important thing for us to talk about because we've designed our office so that they don't have to go to the oral surgeon for one thing, to a dentist to place the crowns. I place the teeth, I design the system. Everything's done by computer imaging, which we have in the office, and it makes it ideal for the patient and for the practice.
Now this is, we've talked on the phone and also in the green room, but you say this is like the happiest group of patients. People, when it's all done, they want to hug you. In fact, they don't even let you out of the room without a hug, you said, one lady.
Yes.
Really?
That's a great story. And the lady came in and she was so depressed. She says, I cannot eat. My dentures will not stay in my mouth when I try to eat, and I can't eat salad. I can't eat anything. And I said, well, I think that we have a good solution for you. Why don't we talk about that? She came in. She had a new upper and lower removable denture made. And so we're over at Applebee's one night after I'm finished with the procedure, and she said, Dr. Berger, now this is from across the room in Applebee's, from across the restaurant. And she says, I'm eating salad for the first time. I'm having shrimp and salad tonight. I just can't thank you enough. I want you to come over and meet my family. And so she's talking all the way over across the restaurant. And I introduced myself to these people, and by that time, of course, everybody in the restaurant knew exactly what was happening. So I was very happy with that moment. Back to your original question about why patients don't come in with the dentures, because they've been out of the loop for so long. They don't need a dentist because they're just happy the way that they are, and they don't know what their options are. And If you're a denture wearer, you use a lot of polygrip or some type of adhesive. You've been concerned all your life about the fact that you've had to spend too much money going to the dentist. You've been in pain, you've had failed root canals, failed teeth, and you're just happy not to have to be there. But now, being a denture wearer, you're tied to something that you really don't like to do.
They just adapt? Is that your take
They
on
just
it?
adapt. That's kind of the way it is, especially out of my generation, where you just get up in the morning, put your pants on, do your work, and you're happy to have teeth to work with, but they're not happy people when they start to move around and they're uncomfortable to chew. And they don't have the same diet. It's a known fact that when a patient has, or when a person has their own teeth, they can chew at 100%. And as they lose teeth and they finally get to dentures, they're down to 30% efficiency. So they're not healthy, they're not able to digest
So they're
properly.
just kind of rubbing their teeth
They're
together?
just rubbing their teeth
food?
together without being able to actually chew their teeth with the original efficiency that they had. And so they don't enjoy their food as much. And they're always embarrassed to go out and be in public with their friends, and all of a sudden, I've got to excuse myself to the bathroom. They got to go in and clean their denture out and the food out
right?
and whatnot.
They tell you this?
Yes. And finally, what can I do about this? And we have a solution for that in the small diameter implant.
Now you say things like, I guess, I'm paraphrasing slightly, but like teeth in the same day. I mean, people can walk in on the day of the procedure. They can walk in with no teeth and walk out with teeth.
That's correct.
Is that right?
And
is that rare?
do-
Is that rare?
It's not rare in this procedure. It's not rare at all. One of my favorite stories is about the CEO. So he's got to go speak to different groups, different people all day long, and I actually brought a picture of his original smile.
Okay. This is a
cracked-
denture I'm looking at?
Cracked denture, and he's just not confident with that. He can't smile big and wants to drop out. And his bottom teeth, he just can't use them. He can't eat. He can't enjoy that. He's embarrassed when he's in public. And he said, my whole family and myself have been failures with the dental thing. Is there some option, I've seen by your ads that have shown up in the paper and whatnot, that you have an option for me? And I said, yes. And he says, but I hate dentists. I hate pain. I said, why don't you just sleep through it? I can give you some conscious sedation. You can sleep through this process. You'll wake up, you go home with teeth.
Okay.
You go home with a smile. You'll go home and you'll be able to eat anything that you want. And so in one appointment, we were able to provide him with a beautiful smile, beautiful fitting teeth, and continue on with his life.
And they don't come in and out? They don't come in and out?
And these were cemented permanently, and they don't come in and out at all. This is after we got all done.
Looks good. It's a big difference from that before.
It is, and of course, he was in last week, so we got a final shot of how happy he actually really is. Of course, he reminds me of the typical patient that doesn't have teeth that comes in and says, I can't go out. I can't eat. A giant of a guy.
So they don't like eating in front of people.
They don't like eating it in front of people, but this gentleman didn't even have teeth to eat with.
Okay.
He had one tooth left on the upper and failing on the bottom. Well, let me show you his before photo. He's got one tooth. He cannot eat anything.
So is that like a partial something in there?
There's nothing in there. He's got some lower teeth that are sitting on some failed bridge work, but he needed some help. He says, I can't go out. I enjoy eating steak. I enjoy eating salad. I can't even do that now. And so we were able to, in a one-day appointment, as we were talking about, with sedation, so he didn't even know that he was having the procedure done. And he said, when he got done, I just can't believe that now I can go out. I'm the life of the party. I can enjoy my food. I haven't been able to eat salad or steak or ribs or steak, and I had that dinner last week, and I was just so thrilled to be able to do that. And so
Let's take a look.
here we are. Had a great shot, and then this was last week when we were doing some photos of the work that we were doing with him.
So now when they look at the mirror for the first time, are they surprised?
They're just absolutely ecstatic about the fact that now they have teeth that don't come in and out of their mouth. They're glued in, and they are just like wearing normal teeth.
Now, I have to mention that these mini implants or small diameter implants, I've had people on my show, I've had dentists, qualified guys, that say the problem with mini implants, they're too small. The problem with mini implants is that maybe they're more likely to fall out. That the traditional bigger implants are better, even though they're half the cost. So what are your thoughts on that?
Well, it's just not true anymore because there's been adequate studies, Shatkin studies, that have shown that the small diameter implant actually is stronger than many of the large diameter implants. The 12-year study that they did showed that they have the same success rate as all of the large diameter implants, at least a 94% success rate, which we depend on and have always depended on in offering patients implants. And so it's just not true. The small diameter implants can support single teeth, bridge work, and dentures, and permanent teeth. And the beautiful part of doing the small diameter implant is we're able to use it immediately. There's less downtime. You don't have to spend so much time doing any surgery. We're able to place them. You can eat on them the next day. And so it's a very satisfying experience. What's
your oldest patient you've had that's had this done?
My oldest patient, when he passed away, was 98. We started doing the implants for him when he was 92.
Why would a 92-year-old want to do this?
Well, he still went out. He still enjoyed eating. He still enjoyed his social life, whether it was cards or whether it was the dance or whatever it was. When he went out, he had teeth, and he didn't suffer from any of the embarrassment of not having teeth.
But isn't it true if you've been wearing dentures like 20 years, you don't have enough bone to do this?
No, that's not true, because a denture wearer does suffer bone loss. They don't know it. They don't know it until their dentures are loose, and then they think that, well, now I need to go talk to my dentist about doing a reline. And of course, now we're obligated to tell them about and share the fact that we can do stabilization with this small diameter implant. And if they are able to literally drive to the office, walk into the office, hobble into the office, I'm able to show them that they, in fact, probably do have enough bone to stabilize those dentures.
Is this one of those things where, when it's done, they say, I should have done this years ago?
Yes.
Do you hear that?
Absolutely. It's a very common comment.
Okay, we're going to take a quick break. We come back. I know you have more photos. We have time for a few more. And more about the process, what people can expect. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I'm Dr. Paul Berger's patient. I've recently been transitioning from dentures, which I've had for about 15 years. I really wanted something that was more of a permanent fix and something that I can enjoy for the rest of my life. I got my implants put in last Thursday. This is now Wednesday. I've actually been able to work from home most of the time and been able to fully function. They were able to do sedation here on site and were able to allow me to go through the entire process pain-free. Overall, I've been very, very happy with the whole process. And my wife also has been very happy. She sees that I am enjoying my smile a lot more than what I did even when I had my dentures.
You're watching The Wellness Hour. I'm Randy Alvarez. Today's topic, replacing missing teeth with the new small diameter or mini implants. With us, we have an expert on the topic, Dr. Paul Berger. Dr. Berger, thanks. Welcome back to the show.
Thank you,
I know you have
Randy.
a lot of photos. So do you think this is the future of dentistry? That means maybe whether it's 20 years, and I know your sons are dentists, but do you think in 40 or 50 years that dentures as we know them today, which are sitting on nothing other than adhesive, that they'll be gone, that it'll all be attached to something?
Yes, I think the future holds promise for the people that are wearing dentures to not have to suffer with the denture problems that they have today.
Now, what about the people that have, they still have teeth, but they have the bleeding gums and the gum disease, and their gums are bad? With bad gums, can you do this?
Yes, we do need to remove teeth many times because of the bad gums and the infections that they have. But the solution is that they can go back to having their teeth. They can go back to having their life. They can go back to being able to smile again without being embarrassed.
So even with bad gum disease, you just clear up this bacterial infection, their gums get good, and they support the implants.
Yes,
Is that
they
right?
do. That's correct.
Okay. You like to say for many of these people, it's life-changing.
Yes,
Really?
it is. With the changes that go on with gum disease and crooked teeth, lots of fillings and things that are unsightly and whatnot, if people are losing teeth, they like to have an option. It's life-changing. They want to be able to have that smile, that persona again. And so, I have an example of that.
All right.
A lady that's a wonderful lady, but she just doesn't like the looks of her smile anymore.
Okay.
And she wants to have an option. And so because we were not able to save the teeth, we
So
were
those
able,
teeth, those teeth you couldn't save.
there was nothing that we could do to save those teeth. And her sister, who lives in town in Sonora, she lives in the Bay Area. She's 3 hours away. She says, you got to come see this dentist because he's going to help you get your smile back. And that's the first thing that she said when we did the treatment for her. So her options were going to have to be dentures, and she just could not stand the thought of wearing a plate in her mouth. Her whole life had been built around this beautiful smile and attractiveness, and said, is there something that you can give me the same day when we do this treatment? And I said, absolutely, we can give you a smile that you'll love. And, by the way, I have advanced training in that. I've trained with Las Vegas Institute of Cosmetic Dentistry, an advanced research center.
'Cause you're a cosmetic dentist as well.
Absolutely. Yeah,
Okay.
I do full mouth restorations as well as the mini implants over those. Understand the shape of teeth, the color of teeth. Teeth are all not one color. They don't have to look like a denture tooth. They actually have chroma differences that make it natural for the smile. The lip line is in the proper place, and that's what she wanted. And so
when you look at her on the consult, do you say, in your mind, this is going to be good?
absolutely,
You think
because
that?
I know what the smile is going to look like when she gets done. And so I've got an example of that. This was immediately after placement.
Take a look. Wow, it's changed her whole look.
I want you to look at the before and after side by side there. The first photo shows the smile that she's not really happy about that smile. It's kind of a guarded look.
Okay.
We get done with the procedure and she holds up the mirror and looks at it for the first time. Now these are just temporaries, by the way. And she says, you've given me my smile back. You've given me my gorgeous smile back. And she's really happy. And of course, last week, I'd like to show you that photo as well.
Yeah.
And she said, I have my whole life back. I can't believe it.
I mean, it's a pretty smart, one of the things, and because we talked on the phone, you said it changes their appearance. When I look at this before and after, she noticeably, and I'm not trying to side with you, people need to know I'm just asking the questions, but it definitely increases the attractiveness, makes her look younger.
In my opinion, it's taken 5 to 10 years off of her appearance, and she is exhibiting that in her smile.
So she would have normally been in a denture.
Normally, the next step for her would have been a denture.
And her sister, who lives in your town,
Right, said, I think
has heard about you, the king of the mini implants.
Yeah, right.
No, but I know you're a very humble guy. But so it really happens in one day, like in one afternoon, the
It
day of the
does.
procedure.
Yes.
It's
She was able to arrive with teeth, and she was able to go home with a new smile and teeth that didn't come out of her mouth.
How soon can they eat when it's
Next
done?
day.
Really?
Same day is soft diet, second day is pretty normal food.
And could she eat like popcorn or nuts or chewy things like
Yeah, yes,
like
she can.
pizza or whatever?
She can eat anything that she wants, really, that she's comfortable with in the healing process.
Now, there's an option, I guess. You could either get a snap in, snap out, like a denture, snap in, snap out, or these teeth that don't come in and out.
That's correct. And they can be made out of denture teeth, but we prefer the newer zirconia type teeth, which
Zirconia?
are an advancement in dentistry. They are harder, more natural looking. They last longer. Very rarely do they chip and break, and that's why we use them. It's the newest technology.
So these mini implants, if you had a family member that lost some teeth, would you do it to them?
In a heartbeat.
Really?
In a heartbeat, absolutely.
Okay, good. Now we have time for a couple more photos. What else are we looking at?
Okay. So here's another gentleman that came in, and his upper denture was not functioning very well, and he didn't have any lower
That's
teeth.
a denture right there? Because it
Yes,
just
that's
looks like
a
yellow
denture.
teeth.
It's the patients hold on to the dentures for years, 20 years plus, and they do the best they can with them. That was repaired many times and was ill-fitting, and so we were able to.
So we heard about you.
Heard about us.
What do they
and,
say when they come in? A guy like this? Are they
Well,
skeptical still?
this gentleman said, you know, my neighbor came in and had his lower four front teeth replaced by you with these small diameter implants. Can you do the same for me? Well, the problem was we couldn't save any of the teeth, and so we had to go with a snap-out denture, which is what he requested. And so we were able to give him his
Very nice.
smile back and his teeth back. And he says, now I go out, I'm not embarrassed to be with my friends. I'm in the party now.
So he could eat again. He could eat whatever.
He can eat whatever he wants now. Now that we're done and he was in for his normal checkup, and of course we clean these implants on this kind of a procedure so that they're fresh and healthy, he says, I've been sending you a lot of my friends because of the work that you did for my teeth.
Now, what about pain? Because it seems like a painful procedure, and you say that, now obviously everybody's different with pain, but some people say it doesn't hurt at all. Is that true?
That is true. The constant comment that I get after we place these implants is we're able to place them without doing a surgical procedure. We don't have to cut the gums. We don't have to put expensive bone grafting in routinely to get these to work. We're able to use the available bone. We're able to place them without having to cut the gums open. And I can place those implants faster than I can place fillings.
Is that right? So the gums, when you have to do like a surgical procedure and open them up, that's what the pain is from. I guess the bone doesn't have a whole lot of pain. Is that right?
Well, not necessarily, but when you have to do an incision in the gums, it's like a cut anywhere else in the body. It's going to take time to heal. It takes pain, medication to be over that, a lot of antibiotics. We're able to avoid a lot of that in this type of appliance.
So they go in, like a person like this. Okay, if everything works out, they go in, maybe you have to remove a couple of teeth, and they take a pill. Most of the time, they take like an oral sedation.
Well, if we do the oral sedation, they take medication the night before. They're nice and relaxed when they come in. We give them some medication when they get to the office, and they are able to go through this procedure. They come back the next day, and this is the honest truth. They say, I didn't even know I was here, and I woke up with my nice teeth.
And they could eat, right away.
And they can eat right away.
Now, somebody like you that mentors other people, also receives an award. You've been doing it like since the 70s. Does it cost more to go to somebody like you to get this done?
No, actually, Randy, it doesn't. The cost of mini dental implants is routinely half the cost of the large diameter implants. And so we're happy to offer that cost savings to our patients, and it makes it affordable for almost everybody.
Now, we should mention that even with the best dental insurance, it doesn't cover this, and Medicare, Medicaid doesn't cover this.
But Randy, we offer financing that makes it very affordable for our patients. We actually offer some interest-free financing. So patients that need to have that additional help are able to get it in our office, and almost everyone is able to be treated in our office.
And you'll work with their insurance at
And
least
we'll
to
work
get...
with their insurance. We'll get every dime out of their insurance that we can get.
Okay, good. We have time for a couple more photos. What else are we looking at?
Okay, thank you very much.
And we are short on time, a couple of minutes. Let's take a look.
Well, we had an automobile accident patient that came in, and we had done some previous work that needed to have some corrections. And so we were able to do the small diameter implant restoration for her. She's in a family of beauty queens from the South, and she needed to have that beautiful smile back. And so when we did her treatment, she just could not put the mirror down. She was so happy with the result.
So what do they like more? They like the fact that they can eat and chew whatever they want, or do they like just the way it looks?
Well, it's a combination of both of those things. Many times they'll come in because they just want to have the smile back. They don't like the looks of their teeth. They're headed for dentures. What can you do for me? And then the other side of it is that sometimes I don't care what the teeth look like. I just want to be able to go out again, to be able to eat what I want and enjoy that. I don't want those dentures falling in and out. I want to have permanent teeth that are glued in. And we get all done and they say, I can't believe how good it looks. It really looks good. I'm able to tell jokes at the parties, and I'm able to have my life back the way it was before I had bad teeth.
So there are a lot of people, and I don't want to be insensitive to this, but there are really that many people that hate their teeth?
Yes, there are.
They don't like their teeth?
Absolutely. They hide their smile. They're embarrassed about their smile. They don't even have to be a denture where they know that they're losing their teeth or that they just don't have, a good option for smiling. And now we're able to put them back into that. A great smile. If you have time, I'd like to show you just a couple more examples.
We got about a minute. I don't want to rush you, but we got about a minute.
Well, this was our lady at the restaurant that came in last week, and we were able to get a great photo together. Of course, I got the hug that I wanted. And she actually wrote a little piece in the paper, which I'd like to share with you.
Mini implants changed my lifestyle.
And we have a lady here that we don't have the before photo, but when she came in for this last checkup, she was just extremely ecstatic. These are teeth that come in and out, snap in and out, not permanently cemented. So we do have options. We've got options of either cementing them in or removing them in.
Snap out is a little bit less expensive.
And she only takes them out every time she comes in for cleaning. It's not like she takes these in and out every day. I take them out when she has her cleaning every 6 months. And finally, a gentleman that came to us that he thought he was going to have to go to dentures, and he was heartbroken about it. He's in the public a lot, businessman for himself. And I offered him the opportunity to do implants for him, and he was in for his checkup, and I got a great smile from him. And he
can eat whatever he wants.
Eats whatever he wants. He brings on every holiday, whether it's Christmas, Thanksgiving, he brings pie to the office, candy for the ladies, special treats because he's so thankful for what we were able to do for him.
So is this like an exciting time for you in dentistry? Because you've seen a lot, right? Where it was a lot of patchwork and now you get your teeth back with these things.
That is absolutely true. I love doing the dental work. I've always loved it. I've been doing it a long time and I don't plan to quit anytime soon.
And they get to see you. So if somebody, and we're out of time, but if somebody's watching this, you do the consults.
I do the consult. The consult is free, by the way. The imaging is free if they accept the treatment, and we're able to put their lives back together with these smiles.
Okay, good. Final message. Somebody's watching this, right? Maybe they've seen your ads in the paper or direct mail, but for whatever reason, they're hesitating. They're afraid. They're worried. They think they're too old or whatever. What do you say to them?
I say that if you're missing one tooth, many teeth, or all your teeth, and you want a solution that is not expensive but affordable and good looking and would help put your life back together, Sonora Dentist can help you do that.
Okay, good. I want to thank you for coming on the show. Great info.
Thank you very much, Randy.
So no more dentures.
No more dentures.
All right. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.